Professor Stephen Leeder is the Editor-in-Chief of the MJA, and I'm talking to him today about our next issue, which is coming out on Monday the 2nd of March. Hello, Stephen.
Hello there, Kate.
This is a mental health issue, and you've written a piece to lead off the issue that speaks to the parlous state the system's in at the moment.
Well, it's an interesting article that I read published in a non-medical journal in the US called, the actual article itself is called Darkness Invisible.
Mm.
And it was published in a journal called Foreign Affairs, which deals largely with international matters, as you'd expect from a fairly conservative North American perspective. But it makes the point that despite the enormity of the burden of mental illness, we still, as a world, have not come to terms with it. For example, virtually psychiatrist-free zone in sub-Saharan Africa. I mean, how do you cope with mental illness in that setting? And the answer is badly, obviously.
Yeah.
And there's a real need for new technologies, new cheap generic drugs, new groups of health workers who can fill that gap. But even when you come and look at the OECD countries in Australia and so on, we've still got a long way to make up here in terms of comparison, the way we manage mental health with the way we manage physical health. As a global problem, it's estimated that you stack up all the things that are going to burden society over the next 10 or 20 years. From a health point of view, mental illness will, by 2030, just about be on top. And there's some interesting statistics, like, for example, there are estimated to be about 800,000 suicides a year in the world. And I mean, that's a pretty daunting figure. I mean, we've got our share of them in Australia, and there's been recent interest about the mental health and suicide rate among medical practitioners, but also, interestingly, among doctors who've been working in a military zone. They're just as susceptible to post-traumatic stress disorder as the people firing bullets.
Yes.
So I mean, it's a very big problem, but the point they make, the authors of this report make, is that while we continue to see mental health problems as purely a problem for the individual and their family, not worthwhile developing effective national policies around, the problems will persist. So there's a big challenge there to us, I think.
Yeah. I mean, one of the perspectives in the issue is by co-authored by the director of the National Institute for Mental Health Research, suggesting that we've had plenty of reviews and perhaps what we need is one less review and a bit more action when it comes to reform of the system here.
I think that's true, and also the same document highlights the value of including mental health disorders in that group of problems for which we search for at least partial technological explanations and resolutions. So there's an awful lot that can be done, and people don't have to suffer in isolation, whether it's drug therapy, psychotherapy, behavioural modification, whatever it is. There's a heap of stuff. And modern communication technologies like mobile phones,
yes,
which are prevalent in sub-Saharan Africa, for example, can convey helpful messages and provide a basis for interaction between a person with a mental health problem and a practitioner beyond the classical patient sitting in the surgery consulting a doctor model, which is just materially impossible in many developing country settings.
Yes. The other issue that's raising its ugly head lately is the Trans-Pacific Partnership Agreement and what its effect might be on health and medicine here in Australia.
Yes, these free trade agreements, which seem to be secret negotiators' business and wrapped up in phrases like commercial in confidence and we can't tell you what we're doing, stand a really serious risk in the judgment of many people of being outside the normal political and legal constraints. And that wouldn't probably matter much if it was just a secret society that was concerned with stamp collecting or something, but they're not. I mean, this is about transactions that will affect the economic well-being of nations.
Yeah.
And the big fear, of course, is that the big players like North America will dominate to their own market's advantage in the negotiations. And part of that challenge relates to medications and drugs, patents and costs, you name it. So this is again an area where some medical understanding is important, and we've got 2 or 3 people writing around that from the perspective of what, how does this negotiation about cheaper, freer trade affect medical practice in this country, and that's the thrust of the article.
It sounds like there's plenty of food for thought in this one, Stephen.
I hope so.
It's a good thing we've got some poetry in there to lighten it up.
That's right.
Thanks again.
Fine, Kate, that's good.
See you.